All right, I'm ready for part two now, and I want to move to the local area, so I'm going to talk about Snohomish and King counties like I usually do. And I talked before about the thresholds that the governor has set for high risk, moderate risk, and low risk from COVID-19. These thresholds are based only on the number of positive tests, and so they actually will be sensitive to the number of tests you do. If you do 10,000 tests and 100 of them come back positive, that means one thing. If you do 1,000 tests and 100 of them come back positive, that means something quite different. Now, note that these thresholds don't involve that. All that said, there's good news to report here, and in fact, part one was the one that I least like doing. I don't like saying that I don't believe what another scientist is saying, but I had to do that in that case. Here's a case where I can say, look at the data. The data show that King County is actually in the moderate risk category now, when they were in the high risk before, pretty stubbornly. This is nationwide data, and I encourage you to follow the COVID tracking project each day. And I just want to show that the main theme of previous data updates, that hospitalizations were dropping nationwide, continues to hold up. Florida is dropping like a rock in hospitalizations. Texas, Arizona is back to where they were before their outbreak. California is dropping as well. All these big states that you heard about headlines, of course you don't see the headlines, and I understand that. You know, the headline for dropping is not the same as a headline for rising. But we've got to realize our media we are conditioning our media. We're the ones who are demanding this. We demand headlines when things are bad, but we don't click on the headlines when things are getting better. This is getting better. Current hospitalizations dropping, including today, new deaths dropping, and I want to point out, if I can put up a good headline, remember the headlines about 1,000 deaths per day that you got sort of relentlessly over the past couple of weeks? Well, this is the first non-weekend day, was yesterday, where we had less than 1,000 deaths as a nation on a day when we expected more. And you can look at the data, you can see that line is dropping. Again, it's got a fat tail, it's dropping slower than it rose. That's the way these lines work. But we should expect it to continue to drop, because hospitalizations are also dropping consistently. And notice they are continuing to drop to this very day. Now, there's some states in the Midwest that actually have rising cases and hospitalizations. And to the extent that they are actually rising, and even though cases are dropping in the big states that were previous problems, we do have some new problem states in the Midwest, particularly. I believe Missouri, I believe Iowa. I looked around at them, and their cases are going up and their hospitalizations are going up. It looks like this is going to roll through those states next. Now, if you look at the new cases line, the new test line is nice and flat. The new cases line has been dropping, and it's been a little flat before. If you look back here, so recently it's been flat, and there's a bit of a worry that it might be going up. We might have is this the third wave? No, not really. It's the first wave for the Midwest states that are getting hit by it now, or really like the second and a half wave. The terminology of numbering waves actually gets really complicated. But basically, let's look at this on a state-by-state basis as we go through. On a nationwide basis, cases have been dropping. In the past week, they've been flat. That's because we may have a few problem states in the Midwest. But the good news is, even with those problems, currently hospitalizations are dropping. And we expect this same story to play out on a different scale in these different states. Whatever's going on, I do not expect an exponential outbreak at this time. There may be a local outbreak on some level, but I don't expect it to be anything like what Florida, Texas went through as a state. Again, a particular city, particular county, may get hit hard from this point. The good news is we have healthcare capacity, and we can, in different ways, help the places that have the problems. So let's keep an eye on that with an eye toward helping them. I don't think there's any evidence that these are going to seed a sudden outbreak. We've had 6 months where the one place that we've seen that was in New York City. And then we've had 4 big problem states where we've had problem outbreaks that filled up the hospitals, but never exceeded the hospital's ability to care for the patients. I think that's really important, to keep an eye on the hospitals. So let's do that for these Midwest states. Let's do that for the state that you're in to see how you're doing. And let's look at cases. Like we talked about, there was a little mini outbreak sort of in Washington state, although it was more like it was reaching places it hadn't gotten to before. But in King County and Snohomish County, it looks like this. Again, blue is King and orange is Snohomish. Now, the new thresholds that were introduced by our governor about a month ago were scaled to population, and so they're different for King and Snohomish, different populations. And you see that the moderate risk threshold for King is 120, moderate risk for Snohomish is 40. And look at the orange line. It's been below that line. It needs to average below that line for 14 days. Well, now the Snohomish County averages at 29 for the past 14 days when the threshold is 40. So it's definitely moderate risk, solidly moderate risk. I'm happy to know, as you can guess, I've been calculating this number, and this number does calculate out to be below 120. It's like 119, but I'll take that. It's below 120 for the past 14 days for King County. And you can see that the numbers jump around quite a bit, but they are definitely trending down. We're definitely trending into the moderate risk category. We should take this into account. Now remember that the other thing is, this is why I previously noted that Snohomish had crossed into the moderate risk category. So it's taken 2 to 3 weeks for it to drop to about halfway between moderate and low risk. Oh, and by the way, here is the low risk line. It's at 1/3 of the moderate risk line. And you can see Snohomish is getting there. I wish it was a little faster, but I always wish that these days, so I've just got to remind myself to be patient. The King County moderate risk threshold will be 40, so it will be the other line. And you can see that we've got a ways to go, but maybe in a month it could be there if this continues. Both King and Snohomish counties are now moderate risk according to the governor's definition of cases by site. Again, this is all dependent on the reporting date of the cases being the same as the reporting when they're posted on the site, okay? And so there's a little bit of wiggle room there, but this is to the best of my knowledge, to publicly available data. This is what it says. Another thing is Pierce County, to our south, Tacomas County, is also moderate risk, and they've noted that publicly, and they've begun talking about opening schools. They've had to be very careful to explain to people, we're just talking about it now, but at least they're talking about it. I want to say, okay, we've met these categories. What does it mean now? And going down for a number of weeks now, and we are within these categories. Now, the other thing is, I've complained frequently that these thresholds are independent of test volume. It actually creates a disincentive to test more. But there are other thresholds that are in the recommendations, complex and voluminous as they are. But you can see that there's a case positivity ratio, which they actually post on the King County website, so you don't need my graphs, go to their graphs. And they have the test positivity for King County, and I'm happy to say the day before this was 2.1%, now it's down at 2.0%, which is exactly what the target test positivity is. Obviously, we want to see this go down more. Obviously, we have seen it go up, but we haven't seen it go up that much, and then it came down again. So let's take the good news. The good news is, objectively, we have met this particular standard. If we are at target, we should be able to talk about relaxing some of the things we can relax. Not everything. But I believe that schools, if done carefully, can be relaxed in the right way. And I've talked a lot about why I think the evidence holds that up. So, the other thing that I want people to look at is, you can use Yu Yang Gu's C19 Pro model to say exactly how many people in my state or in populous counties in my county does he expect are infected. Remember, we can't test anyone. We aren't testing everyone. It's impossible to know exactly how many infections there are. But he does a model of how many he expects there to be. And because his model's been right on so many other things, I want to take this as the best guess at how many people are infected right now. So look at Washington. You see it's 0.65%, 0.7% is what it rounds to. That means if you take random 1,000 Washington residents from across the state and test them all, you expect 7 to be positive. And I want you to use this as a context for any testing. You expect there to be some infected. You expect there to be some positive. This virus, it's very hard to eradicate a virus. Right now we've got to talk about, are we headed toward the right threshold? And when I test X number of people and I get Y number of positives, is that good or bad? The fact that Y is a positive number is not necessarily horrible. It could be that it's what you expect. And we've got to get, I have 3,000 undergraduates at the college I teach at. If we tested all of them, I would expect randomly there to be 21 of them that would test positive. So if I got those numbers back from my campus, I would not say, oh my goodness, we're in the middle of an outbreak right now. I would say, oh, we actually are exactly where the rest of the state is. And we should expect the trends, as a general rule of thumb, we'd expect the trends to follow the trends of the state if you have mixing of the population, etc. All of this is guesses. But I just want to say, I always ask, how many % positives do I expect if I'm testing 10,000 people and I get 70 positives? Well, that's actually a state in a good place. And it depends on which way they're going. And that's what all the rest of the projections are about. Let's just talk about positives here. So, based on all of this, my assessment of King and Snohomish counties is that they are looking good and looking better. I've been saying this. They're headed toward moderate risk. They're at moderate risk now, and they're headed toward low risk, although it's probably going to take at least a month for King to get there. But the next 2 months look good. They're headed in that direction. Now, something can happen to send it up again like it did before. But realize that this last outbreak that we went through did not tax our healthcare system at all, and did not produce many hospitalizations, and it produced even fewer deaths. They were still there, but it was manageable. Okay? So I think moderate risk is a better label than high risk, and the question is, when will we be at low risk? Now, the main thing is, and I'm going to say this again and again, coronaviruses start to come back in November. So we expect, if these follow that pattern, that's a big if, but it's what I expect, then we expect things to go up in November. But really the question is, how much? How many of those end up in the hospital? How many of those spread to other people who are more susceptible? And that is going to be in November. The seasonality data that makes me afraid for November makes me more confident for September and October. And that's why I say right here, let's use a farming analogy. Let's make hay while the sun shines. Doesn't mean that everything's rosy. The sun can still smite thee by day, okay? But the sun is shining right now, and that trends are looking good. And also, let's keep these trends going with whatever little steps we can do, which, as you know, the best little step is to wear a mask. I don't have, here it is. I got a cool new mask that I can't wait to try out. Wear a mask whenever you're around other people that are outside your household. Okay? Even if you think it doesn't do much, even if you think it doesn't do anything. It's easy to do, and I think it does something. So I can give you my reasons, or at this point, the video's been going on a long time, so I'm just going to say, trust me. And with that, I would like to move on to part 3.